And the first case of Ebola has been diagnosed in the United States. The CDC has confirmed a patient in a Texas hospital is battling the deadly virus. Jim Spellman has more.
CDC officials say this man had recently been in Liberia, the epicenter of the recent Ebola outbreak there in West Africa, and flew back here to the United States. We don't know what he was doing in Liberia or who he had contact with there, but let's look at the timeline because the dates here are really important as they relate to the disease. September 19th, he left Liberia. September 20th, he arrived in the United States. 4 days later, September 24th, he developed symptoms. That's when he became contagious to others. September 26th, he sought medical treatment, but was released. He was not held. September 28th, Sunday, he was admitted to the hospital and put into an isolation ward. That means he was symptomatic for 4 days out in the world, here in the United States. And when a patient is symptomatic, he or she is contagious. They can spread the disease through bodily fluids. Also means whatever medical professionals he sought treatment from on the 26th may also have been exposed. Officials from the CDC, the Centers for Disease Control, briefed reporters earlier.
The bottom line here is that I have no doubt that we will control this importation or this case of Ebola so that it does not spread widely in this country. It is certainly possible that someone who had contact with this individual, a family member or other individual, could develop Ebola in the coming weeks. But there is no doubt in my mind that we will stop it here.
And that is the key in stopping this before it becomes an outbreak here in the United States.